What skin tags and dark skin patches are really telling you? This is question number 5 of the 1-minute insulin resistance quiz, and the link is in the description below. We are going to look at some visible signs of insulin resistance today. Hi, I'm Dr. Kim, a Board Certified Naturopathic Doctor, and I've been in clinical practice for over 40 years. Most people think of skin tags as just one of those things that happens as you get older. You have them removed, you move on, and you don't think much about it. You may have darkened, velvety looking skin on the back of your neck, or in your armpits, or in the creases of your elbows, and you may have been told that's just a skin condition. Or you noticed you have hyperpigmentation, and maybe nobody's mentioned it at all. What if I told you that both of these things, skin tags and darkened skin patches, are visible external signs that your insulin has been elevated for a long time, and that your skin is actually showing you something your blood test hasn't caught yet? Today I'm going to explain exactly what these skin changes mean, what's driving them, and why they belong on an insulin resistance quiz, because this is one of the most under-recognized early warning signs we have. Again, this video covers question 5 of my free 1-minute insulin resistance quiz. I have skin tags or darkened skin on my neck, armpits, or other folds. The quiz is in the link below this video. There are 10 yes or no questions, and it only takes a minute, and I will personally send you back what your score means if you send me an email of your results and which lab numbers are worth investigating for you. The link is in the description below. And please do me a favor and like, subscribe, and hit the bell button. It really does help my channel. These two things, skin tags and darkened skin patches, are separate phenomena, but they share a common cause. And that cause is chronically elevated insulin. Your skin is not a passive covering. It is a metabolically active organ. And when insulin is chronically high, the skin responds in specific, visible, and predictable ways. Ways that a trained eye like mine recognizes immediately as a metabolic signal even before any lab work is run. I want to take each of these separately and explain the mechanism, because understanding why they happen makes them impossible to dismiss as cosmetic concerns. Skin tags are those small, soft, flesh-colored growths that hang off the skin, typically at friction points like the neck, armpits, eyelids, groin, and under the breasts, and are extremely common. Roughly half of all adults will develop at least one in their lifetime, but frequency doesn't mean they're meaningless, and the medical literature is consistent on this point. Multiple skin tags, particularly appearing in clusters or at a younger age, are significantly associated with insulin resistance and elevated fasting insulin. And here's why. Insulin is a growth-promoting hormone. At normal levels, that's fine. Insulin promotes healthy tissue growth and repair. But when insulin is chronically elevated, that growth signal is amplified throughout the body. Skin cells, particularly the fibroblasts and the keratinocytes in areas of friction, respond to that elevated insulin signal by proliferating normally. The result is a skin tag. Studies have shown that people with multiple skin tags have significantly higher fasting insulin levels, higher HOMA-IR scores, and higher rates of metabolic syndrome than people without them. The more skin tags present, the stronger the association. So when I see a client or patient with multiple skin tags, especially appearing over the past few years, especially in someone who also has other symptoms that they've determined by taking the 10-question quiz, that is a clinical sign that I take seriously in my practice. It tells me insulin has been elevated long enough to show up in the skin. Now, the darkened skin I'm referring to has a clinical name, acanthosis nigricans. And let me say that slowly again. acanthosis nigricans. It appears as dark, velvety, thickened patches of the skin, typically on the back of the neck, in the armpits, and in the skin folds, sometimes in the groin or inner thighs, and occasionally on the knuckles or elbows. It's often mistaken for a skin condition or for dirt that won't wash off, or for sun damage. People can be self-conscious about it for years without knowing what it actually represents. What it does represent is this: chronically elevated insulin stimulating a specific type of cell, a skin cell called keratinocytes, to overproduce. The result is that thickened, darkened, velvety texture. The darker appearance comes from the excess skin cell proliferation reflecting light directly or differently than normal skin. Acanthosis nigricans is one of the most reliable visible markers of elevated or insulin resistance that we have, elevated insulin in the blood. In pediatric medicine, it's often the first clinical sign that prompts screening for insulin resistance and diabetes in children and teenagers. As a side note, my mother used to tell me as a child to go wash my hands because she thought my knuckles were dirty. No amount of washing was able to remove the dark color, and obviously I had insulin resistance as a child. It is not a coincidence that this appears, and it is a direct consequence of elevated insulin acting on skin tissue. And here's what's important: it can be present when fasting blood sugar is completely normal. Because, as we've established throughout this series, blood sugar is the last thing to change. Insulin rises first, and the skin responds to insulin, not to blood sugar. On the functional medicine side, we check function. Acanthosis nigricans is a function. It's the body's visible response to an insulin environment that's been dysregulated, possibly for years. And before we move on, please like, subscribe, share with friends, and hit the bell button. It really does help me get new videos out to you. Now, I want to make an important point about what these skin signs tell us about the timeline of insulin resistance. Skin doesn't change overnight, and skin tags don't appear after one bad week of eating. Acanthosis nigricans doesn't develop from a temporary insulin spike. These changes develop over months to years of chronically elevated insulin. And that means if you have these signs now, if you'd answered yes to question 5, your insulin has likely been elevated for a significant period of time, possibly long before symptoms become obvious to you. This is actually useful information. It tells us that insulin resistance isn't new, and it's been building over years. And that means we need to approach it with a strategy that addresses a pattern, not a recent event. It also means that standard labs, which have presumably been run in the meantime and come back normal, have been missing this, which brings us back to the importance specifically of requesting fasting insulin and fasting blood glucose so you can calculate your HOMA-IR yourself. For someone with skin tags and or acanthosis nigricans, here's what I'd want to see in labs. First and most importantly, ask for fasting insulin and fasting glucose blood tests from your medical doctor for calculating your HOMA-IR. Given the skin findings, I'd expect fasting to be elevated. If it's not, I'd look more carefully. But in my clinical experience, these skin signs and elevated fasting insulin travel together reliably. Second, also ask for a hemoglobin A1C test, which gives us a 3-month average blood sugar picture. Even if fasting glucose is normal, hemoglobin A1C can sometimes show subtle elevations that add to the clinical picture. Third, ask for a lipid panel including triglycerides. High triglycerides and low HDL are both common companions of insulin resistance and often appear alongside these skin changes. Together, these labs confirm the metabolic picture, what the skin is already showing us visibly. The skin gave us the signal. The labs tell us how significant the dysfunction is. If you have skin tags, acanthosis nigricans, or both, please take the full quiz in the description below. because these skin signs almost never appear in isolation. They're almost always accompanied by other symptoms on the list. Your total score combined with these visible markers gives me a very clear clinical picture of what needs to be investigated and how urgently. I respond personally to every score if you send me an email. The link is in the description below. So now what can you do? First, take the skin findings seriously as clinical information. Don't dismiss skin tags as cosmetic or acanthosis nigricans as a skin condition. They are metabolic signals. Document them. Photograph them. Note where they are and when they appeared, and even count them. Second, bring them up specifically with your doctor at your next appointment. Tell your doctor you have skin tags and or darkened skin patches, and you want to rule out insulin resistance. Ask specifically for labs that include fasting insulin, fasting glucose, and hemoglobin A1C, and a lipid panel. Some doctors will recognize the clinical connection and order the labs. If not, it's worth having labs drawn privately by a naturopathic like me. You will have to pay out of pocket, but it's worth it. And third, take the insulin resistance quiz. 10 questions, and it only takes 1 minute, and then send me an email with your score, and I'll tell you your biggest health struggle, and you'll receive a personal response from me. You know, your body is always communicating. The question is whether you know how to listen. Skin tags and darkened skin patches are your body communicating clearly and visibly that insulin has been elevated long enough to affect your skin cells. That's not something to be embarrassed about or treat cosmetically and move on. That's a signal worth investigating. And the good news is that when insulin resistance is addressed effectively, these skin changes can improve, and mine did over the years. I don't have acanthosis nigricans. It can fade, and new skin tags can stop appearing, and I've had a few over my life. The skin is responsive to metabolic improvement, as it is to metabolic dysfunction. So go take the quiz in the description below and send me your score. The coaching call is also in the link in the description if you're ready to go deeper. Next in this series is question 6. I have a parent or sibling with type 2 diabetes. Family history isn't your destiny, and I'll explain why in that video. I'm Dr. Kim, the Insulin Resistance Doctor. Know your numbers, change your future. I'll see you in the next video.